this lesson is actually the last lesson we're going to cover in this course. You have the next 3 weeks to work on it because it's a lot of information. Okay, there's a lot of diseases here, and I really want you to take your time going through this stuff and really digest every single disease and make sure that you know it. So infectious diseases of dogs. Infectious diseases are diseases that can be passed from one animal to another. Okay, and it's caused by a pathogenic microorganism of some kind, whether that be a virus or bacteria or protozoa. The first one we're going to talk about is canine distemper, and there is a vaccination for this. It's caused by inhalation of an airborne virus, and symptoms of distemper are vomiting and diarrhea early on, and then later on the animals will display tremors or epileptic fits or seizures. There's canine parvovirus infection. Again, it's a virus, and it's caused by contact of materials that's contaminated with feces from infected dogs. There is a theme with this lesson. Everything routes back to poo. Okay? So, contaminated feces are really the main way that diseases are transferred. Really, this affects mostly young puppies. Symptoms include vomiting, bloody diarrhea, and refusal to eat. Kennel cough or tracheobronchitis is a respiratory disease, and it's contracted in confinement. Okay, so pet shops, dog shows, kennels, that sort of thing. Main symptom here is coughing. Rabies, we talked about this a little bit when we talked about safety and zoonoses. It is a zoonosis. It's a viral disease, and it attacks the central nervous system. Any warm-blooded animal can transmit rabies. Symptoms will occur somewhere between 2 weeks to 3 months after the animal is bitten. If it's a severe case, it can actually be within 10 days. There's two main types of rabies. There's furious rabies and there's dumb rabies. Furious rabies is where the animal, that's kind of your stereotypical rabies animal, okay, where they're acting really weird, they wander off, they attack, they bite anything. Commonly they're seen frothing at the mouth, anything like that. That's your furious rabies. The dumb rabies is really the animal doesn't wander, but they end up suffering from paralysis of the lower jaw, and then that's followed by paralysis of the entire body, and then eventually death. Canine brucellosis, this is a bacterial disease that's actually spread through breeding. In females, it'll cause abortion, failure to whelp, and enlargement of the lymph nodes. In males, it will cause swelling of the scrotum and testicles. Salmonellosis is another bacterial disease, and it's spread by ingestion of food contaminated by feces, typically. So non-infectious diseases are diseases that cannot be passed from one animal to another. Heart disease is the first one we're going to talk about. There's two main types. There's congenital, which is a birth defect, and contracted. The most common symptoms are coughing at night while they're sleeping, coughing during exercise or inability to exercise, open mouth breathing or panting when they're resting, that sort of thing. Cataracts are another non-infectious disease. This causes cloudy, kind of white opacity of the eye lens. It can be hereditary, but it also could not be. It can cause blindness, and really this more often affects the sight of older dogs. You're not going to find this as much in young puppies. And then arthritis. Arthritis is the same thing that it is in humans. It's a degenerative joint disease that causes pain, lameness, stiffness in the joints, that sort of thing. Typically speaking, large, old, and obese dogs are more prone to the disease. So if you have a big dog that is overweight and they're old, you've set yourself up for arthritis. But your bigger breeds are gonna run into this. Your older dogs are gonna run into this, and any dog that's carrying a little extra weight could run into arthritis. These are some typical points in the dog where you're going to find arthritis. I actually grew up with a lab, and he ended up having arthritis in his back, and he had intervertebral arthritis. Poor guy. So fungal diseases. So fungal diseases are caused by fungi. Ringworm is the most common fungal disease across any animal. Symptoms will begin as broken hairs around the face, ears, or feet, and then you'll see reddened skin and scaly skin kind of develop. And then that'll be followed by crusting and scaling in really severe cases, but for the most part we catch it before that gets to that. Blastomycosis is another fungal disease, and this is where spores of infected soil are actually inhaled. Typically, it's infected because it has either bird or bat droppings included in it. Okay, so again, everything routes back to poo. Symptoms of blastomycosis are coughing, rapid breathing, pneumonia, and fever. Internal parasites. So these are parasites that live inside the animal, and they get their nourishment from the animal themselves. Ascarids are roundworms, and these things can grow up to 8 inches in length when they're fully mature. They live in the small intestine. They affect mostly puppies, and what ends up happening is those roundworms eat all the nutrients that come into the small intestine, so the puppies don't get anything. And then the puppy ends up what we call unthrifty or unhealthy. Roundworms will live in the small intestine until of any dog that's less than 6 months old. Most of the time they're transmitted by female dogs to their puppies. Severe infestations in puppies will actually cause them to have a pot-bellied appearance, like this little puppy on the left over here. They can really be a danger to children, because children, for the most part, are going to want to, they see the cute little puppy, they want to play with it, and then, before you know it, they've somehow managed to get fecal matter on their hands or something like that, and then they can end up with roundworms as well. Hookworms. These are nasty-looking little things. They're a blood-sucking parasite, and they actually attach themselves to the walls of the small intestine, and they will cause really small spots of bleeding. Adult worms are about 1 inch long, and they attach themselves to the small intestine, and they digest a plug of tissue from the small intestine. And heavy infestations really can cause the animal to appear very weak, kind of listless and anemic, and that's all really a result of the blood loss. Really, it affects older dogs as well as puppies. No one is immune to the hookworm. Whipworms. Whipworms look exactly like you would think they would look. They look like a whip. They're broad at one end and narrow at the other. And they use that narrow end to attach to the cecum and the lower digestive tract. When they're adults, they're about 2.5 inches long, and they will produce eggs that are actually protected by a shell. And those eggs can live in the soil for years. They will produce watery feces, kind of looking like diarrhea, and they can result in death and dehydration if they're left untreated. Tapeworms. Tapeworms are usually the largest worms that affect dogs, and they usually reach about 1 foot or more in length. Most of them depend on a host, like a flea or a wild rabbit, to develop. But there are these flat segmented worms. And down here I've got a picture of it where you can actually see the separate segments. And they live in the small intestine. They will shed those segments in the feces. They're really not super harmful for dogs, but they can end up causing serious injury to people. And this is, again, generally speaking, we're talking about kids here, because they want to play with the puppies because they're so cute, and then they end up getting fecal matter on their hands, and then they end up with a tapeworm. And heartworms. Heartworms are the really thin, skinny worms. They can actually grow up to 14 inches long, so over 1 foot long, and they live in the major artery that carries blood from the heart to the lungs. And it's really a serious threat to dogs. It'll cause major injury to vital organs, particularly the heart and lungs. Symptoms can include frequent coughing, labored breathing. If you've got a severe case, your animal might pass out. They're actually transmitted by mosquitoes, so they're definitely a threat in the summer. Really, they're a threat all year round, but in particular in the summer. Really, prevention is easier than treatment. If treatment is going to be successful, it really has to occur early on. You have to catch it early. We'll talk about cats in the next video.